Well, my name's Patsy Maclean, and I'm a registered nurse and a practicing lawyer in the province of Prince Edward Island. And I am very pleased to be here in advance of Nursing Week. I graduated from the PEI School of Nursing in 1979, and I had the opportunity to practice nursing for 11 years. And so I began with the adult nursing and then moved into the area of pediatric nursing, neonatal intensive care nursing, and I was also a float nurse for a number of years as well, so I got an opportunity to try different areas of practice in nursing. Throughout those 11 years, I had the opportunity to work with lots of people who were experiencing ethical dilemmas in their own care and questions that they would be asking about that. In the area of neonatal intensive care nursing, you often encounter legal and ethical issues. If you work in adult intensive care nursing, you're often challenged with legal and ethical issues. And I also enjoyed the opportunity to work on my degree as a practicing nurse. Did my baccalaureate degree in nursing through the University of New Brunswick. We were actually the guinea pigs, the first class that were able to take our nursing degree in Prince Edward Island through the University of New Brunswick. And I was very intrigued by the critical thinking aspect of that program that was offered to us, and I was also intrigued by, through that critical thinking, that the legal and ethical issues were always coming up in my mind. So I had a couple of friends who were lawyers, and I originally was accepted for a Master's of Nursing program in maternal child health care at Dalhousie University, and I thought that that's where I might go next in my nursing practice, in my profession. And then I was weighing the idea of looking at health law as an area of practice as well. And so I chose law school. And in 1990, I left the Queen Elizabeth Hospital and left the neonatal intensive care nursery, and with lots of trepidation in my heart, trucked off to Toronto, and I attended Osgoode Hall Law School in Toronto in 1990. Audrey, I've always been very proud to be a registered nurse. When anyone asks me, what do you do? I say to them, well, my first profession is nursing. I'm a registered nurse. And then I say, and I'm also a practicing lawyer. And they look at me and they say, what an odd combination. And I say, it's not odd at all. In fact, it's made sense to me from the very beginning. And so what I love about my ability to take my very intensive, I think, education as a registered nurse and marry that with my very intensive education as a practicing lawyer, I say to myself, I am so grateful for both, because the work that I do presently is multifaceted. I'm a consultant in a firm that is a private sector firm, and I'm a business owner, and so I own a consulting firm in Prince Edward Island. And my practice entails a number of things, so I'm often asked to look at the way Health PEI or other government departments here in Prince Edward Island are delivering services to islanders in PEI. And often I'm asked to look at health services, or I'm asked to look at social services, or I'm asked to look at services in the justice system. And so when I come to do that type of a review, what I would call that is if I'm asked to look at practice and policy in healthcare, and often nursing practice and policy in healthcare, as well as other professionals, and how are they delivering services, I couldn't do that without my background as a registered nurse and my background as a lawyer. And without sounding arrogant in any way, what I would say to you is that people will say, well, we would like Patsy Maclean to do this work, because Patsy Maclean understands what it is to be a registered nurse. She understands healthcare. She understands what it's like to be a frontline professional. She also understands what it's like to be an associate director of nursing. She also understands what it's like to have been a deputy minister of justice in Prince Edward Island. She has a sense of this in a much broader context. So the two marry themselves very well together. But on a more practical level, what I would say to you is that in the work that I do, I also do mediation. And I'm asked to come in and help with multi-party conflict. I'm asked to come in and resolve conflict. Often I'm asked to come in and resolve conflict amongst healthcare professionals. And as we know, when I first started practicing nursing, we didn't always talk about the team. We didn't always talk about what's the role of the registered nurse in the team? What's the role of the physician in the team? How about that physio or OT that's coming around the patient and working with that patient? We tended to work more in silos in our profession. And what I've learned is that we've made great strides as a registered nurse in a collaborative profession. But what I also say to people is, it's not easy to work collaboratively, and there's lots of skills that we need to know about. And one of them is, how do we resolve an issue if we look at things from different lenses? I will probably come in with a registered nurse lens. A physio would come in, a physiotherapist would come in with a physiotherapist lens. A physician would come in with a physician's lens. And so sometimes we don't always share the same ideas on how to case manage someone. And so sometimes I'm asked to come in and help facilitate or mediate those sorts of challenges that may crop up. And I think that what I can bring is that I can bring my registered nursing lens, and I can also bring what I would have learned as a lawyer, my mediation lens or my conflict resolution lens, to assist people to learn how to work in a collaborative and case-managed way around a patient and a family. Always keeping the patient at the center of care. The other thing that I would like to share with you, Audrey, is that I am the chair of the Criminal Code Review Board in Prince Edward Island. It's probably not an entity that's well known, so I'll just speak about it very, very quickly. For people who come into the justice system and may have committed an offense, a criminal offense, they may come before the criminal courts in PEI or the provincial court in PEI, and someone may notice that this person appears to be having some challenges with their mental health. And so an assessment may be done as a result of that. And the assessment's purpose is to determine, was that person fit to stand trial? Are they fit to stand trial because of their mental state? Can they cognitively understand the aspects of the offense, the whole aspect of the justice system and what will be happening to them and the various players in it? Or do they have a mental illness that did not enable them to be criminally responsible for their offense? If the judge decides through an assessment that that's in fact the case, they come before the Criminal Code Review Board, and I'm the chair. On that review board, I chair that, so I'm a nurse lawyer, and then we have a psychiatrist, a psychologist, another person who represents the public, and a lawyer on that review board. And so we hold hearings on a regular basis for people who may not be criminally responsible, and we make decisions. And so what's critical to those decisions is that we must consider public safety, and then we need to consider the needs of that person from a mental health perspective, an addictions perspective, from a case managed approach to assisting them to regain their health so that they can be reintegrated into the community safely. I couldn't do that work, I don't think, if I wasn't a registered nurse, a healthcare professional, and a lawyer. I find that it's one of my most rewarding pieces of work that I have in my practice. I am always so proud when I see National Nurses Week come up, and I'm always watching what's happening with the Association of Registered Nurses. There's times when I'm asked to come and work with registered nurses, and I have a sadness because I don't think they appreciate what they do and their role as a patient advocate, their role ensuring that patients' needs are met, that a care team comes around them, that their voice is heard in their care plan, that their decisions are their decisions, that they have the opportunity for choice in their decisions, that they understand what's happening to them, that their ethical considerations are met, that legal considerations are met. Nurses have all of this under their code of ethics, and they carry this with them every day. Well, one of the things that I think about registered nurses is over the years I've seen incredible nurse leaders. And what I would suggest to registered nurses is never be afraid to take the opportunity to lead. If someone gives you the opportunity to take a leadership role in a healthcare system, on your unit, wherever, private sector, public sector, take it. Nurses have the ability to be incredible leaders in the places that they work. Registered nurses have incredible competencies, I believe, to be leaders. They have the ability to be critical thinkers. They have the ability to bring people together. They have the ability to look at patient care and health care from a broad perspective. I think that one of the things that has caused me to feel somewhat sad for nurses over the years is they may be reluctant to step into leadership roles. And I understand that because nurses, registered nurses, often want to provide care and support, hands-on care and support with the family, front line, with their patients, front line. I understand that I would have to say that I've gone into leadership positions and left leadership positions for those very reasons. So I would say that to nurses. Don't be afraid to step into leadership roles. The other thing that I would say to registered nurses is always remember your professional guidelines. Always remember what guides your practice. I understand how difficult it is to work in healthcare, both in the private sector and in the public sector. We're struggling with resourcing from a human resources point of view and from a financial resources point of view. I have the opportunity to teach new and budding registered nurses at UPEI in 3rd and 4th year, and I speak with them about legal and ethical issues in nursing. And what I say to them is never feel the need to compromise your professional ethics, what you know to be right from an ethical or legal perspective. Never feel the pressure to do that, because as a professional, that is what makes you a professional. What I would say to registered nurses is, you are a profession that has such high public trust. There's a reason why you have such high public trust. You have that because people believe you, that you are their advocate, that you are there to care for them, to help them have their needs met in an ethical and legally responsible way. And never lose sight of that. Always hold the trust that you have from the public with you every day, and allow that to guide your actions. Always go there. I say that when someone asks me what I do, I say, I'm a nurse first. I'm a registered nurse first. It's my first profession. Always be proud of that. It's a fabulous profession. It's a challenging profession. It can be a difficult profession. But what I would say to you is raise your head with pride. It's a fabulous profession.